John Hook's Newsmaker Saturday starts now.
Thanks for joining us on Newsmaker Saturday. We're going to take a moment in the program tonight to get a snapshot of where we are in COVID-19 with Will Humble, my friend, who's a former executive director of Arizona Department of Health Services. Great to see you, Will. He's now heading up the Arizona Public Health Association.
Good
we
evening,
finally
John.
Got our lunch in.
That's right.
So that's good, and we'll do it again. Will, thank you.
Thanks, by the way. John treated.
Hey, listen, thank you for helping us again, because we get some great information out here. Can you just give me kind of a grade on where we are in Arizona right now in this moment? How are we doing with COVID?
Yeah, things are starting to look better in terms of the number of new cases per day. Generally, I'd like to see a steeper decline in new cases per day among people over 65, because they're the ones that are most likely to have a bad outcome and need hospitalization. We are also seeing an increase, actually, in the number of new people going into hospital beds in Arizona, both intensive care and regular general ward. More than 25% of the hospital beds in Arizona right now are occupied by mostly unvaccinated persons with COVID-19. And our hospital system is not designed with a 25% headspace.
Yeah,
in other words,
let's look at the numbers, because I've got it on we're going to go on the wall here.
Okay.
And pardon me if I mess this up, but we're going to look at cases first, because you mentioned it. Let's take that full, and you'll see it on your screen as well. Cases are declining. You can see we had a peak in August, and that's the peak there at the top of your screen. We've certainly come down from that,
right.
But we still have cases.
Right, and you see that lower, that lighter shade near the bottom, that's the people over 65. And so you can see among the younger generation, the younger folks, a more steep decline in the number of cases, but you don't see as much of a decline in that older age group, which is what I was saying. And those are the unvaccinated people over 65. I mean, yeah, they've chosen not to get vaccinated.
Yeah, I wanted to take, and you talked about hospitalizations. This is COVID-specific hospitalizations.
Right.
And as you mentioned, we still have a fair number of people who end up in the hospital from this.
That's right. And importantly, they're taking up capacity that other people need. So there are people that need to have regular surgery procedures, a gallbladder, or a heart valve procedure, or all kinds of things that need to happen inside the hospitals. And when they're as jam-packed as they are right now with COVID patients, it necessarily puts people's procedures back. And there's going to be listeners watching this right now saying, yeah, that happened to me, where my doctor had to slow down and postpone the procedure that I need because there's no room.
This is hospital bed availability. Let's take a look at this. This is pretty interesting. And it's the middle graph there, in use by COVID patients in the red. Mm-hmm. And that is starting to tail a little bit, but still up there. And the thing that's interesting, the light gray at the top in that middle graphic, that's the headroom we have for hospital beds, and it's still a little tight, about 8%.
Oh, it's very tight. And quite honestly, John, it's tighter than it looks on that graph, because there are people not being admitted right now that would normally have been admitted because there's just a staffing shortage. And that's, everyone talks about beds. Well, it's not beds that's the issue. It's staffing. A bed doesn't treat anybody. Doctors, nurses are the ones who treat people, and respiratory therapists.
How much of that is, do you suspect, the vaccine mandates for healthcare workers, that some are balking at a time when we can ill afford it to lose people?
I don't think that's a factor yet, because the deadlines haven't hit. We'll see what happens at the beginning of November to see if that becomes a factor. It could, I think, in some especially rural hospitals. That could end up being a factor. The biggest things, when I talk to people in the industry, they tell me the two biggest things are just plain burnout from the number of shifts. And also, and I hate to say this, but sometimes it's family member behavior and patient behavior who family members come in, for example, to visit, and they don't want to wear a mask, even though it's hospital policy. And it doesn't take very many of those kinds of incidents to demoralize nurses into thinking, look, I'm just going to take a 4 or 5 month break, because you know what? They know that they can take a 4-month break, and when they decide to look for a job, they're going to find one in a couple days.
Absolutely. Yeah, right. Okay, let's look at deaths. This is a really tough one, but we can see a precipitous decline in deaths in Arizona. as you go toward the end of that. That's the best news, because even though we've got people getting sick, we don't seem to have as many people dying. That's great news. And when you look at the bottom of the screen there, the dark red, that's 65 plus, and that again is the overwhelming lion's share of deaths in Arizona. And again, these numbers are just the Maricopa County slice, but as we talked before, that's very representative of the entire state.
Yeah, you got that exactly right. It's been that way since the beginning. It's older persons who suffer the most from this. And the reason we see the decline is, number one, people getting vaccinated. So the big vaccine effort throughout the spring. Most people 65 and up are vaccinated. And so that's a big reason for the decline. But also, there are some treatments that weren't previously available. Regeneron, that's a monoclonal antibody treatment that, if given early, can benefit some patients. And so clinical treatment is getting a little bit better too over time.
Will, the other thing that stands out to me as we're getting ready to vaccinate kids ages 5 to 11 is you look at that younger than 20, 12 deaths. I mean, we've talked about it. Every death is horrible. We don't want that. But 12 deaths in a state of 7.5 million. That is not a statistically significant number.
Right. This illness has never been as serious for young people as it is for older. That's what it's been from the beginning. But remember, John, one of the reasons that we need to get kids vaccinated so badly is because they are the ones that start chains of transmission. Just like the nightclubs last summer and all over the last winter. The chains of transmission start among younger persons, and they infiltrate into the rest of the community. And then they finally end up infecting somebody who is at higher risk, who does have a bad outcome, needs hospitalization, or God forbid, dies like you just showed. So it's not just the clinical outcomes that we're interested in with the vaccine, but also getting the number of raw infections down so that we reduce community spread, so that the higher risk people don't become infected in the first place.
That's interesting, because one of the really interesting things, and we've talked about how Israel has kind of been on the cutting edge of this entire COVID thing. This was an interesting statistic that gets into what you just said. When all people living in the same house are vaccinated, the chance of any household member contracting COVID-19 is reduced from 57% to 4%.
Yeah.
So
that's it. That's what this is all about, is slowing down the chains of transmission. And that's why it's so important for us to do a good job with the kids from 5 to 11. Like you point out, not necessarily because they're going to end up in hospitals, but because they start the community transmission and amplify that, which spreads to the other groups that are at higher risk. Okay,
macro view. This is across the country. 7-day moving average in the United States. New cases have decreased 12.5%. Deaths are down 13% from a week ago. I mean, new hospital admissions down 8.8%. Are we at the end of this thing? And is Delta the variant that's going to be kind of the end game?
Yeah, there's no way of answering that definitively, because I'd have to be a fortune teller to tell you that. What I can say is that right now, globally, nothing is out competing Delta. That's not to say it couldn't happen. A new variant could come about that's more transmissible, and eventually that would end up taking over from Delta. But as of right now, to what you're saying, we are on a decline. There's a lot of social mixing that happens over from Thanksgiving to Christmas, and that could be a wild card factor here. But, I'm optimistic that we can get a lot of these kids vaccinated over the next couple of months. I'm not optimistic that we're going to get a whole lot more adults that aren't vaccinated yet vaccinated. I think eventually they're just going to get infected and get antibodies that way.
Yeah. I mean, there was a poll done here in Arizona on Thursday. Let me share this with you. It was interesting. Reasons about why people don't want the vaccine. 59% are worried about side effects. 38% think they don't need it. That may be people who've already been infected and they think, hey, I've already been inoculated the old-fashioned way. 27% are waiting to see if it's safe. That's interesting. 45% don't trust COVID-19 vaccines. 43% don't trust the government.
Those last two are the most troubling. How do you overcome that? I mean, if you don't trust the process of, authorizing and then approving vaccines, and if you don't trust the government, where do you go from there to try to convince those folks to get vaccinated? It's a tough nut to crack.
Okay, help me with breakthrough infections. What is going on? I mean, there are people starting to say that this vaccine is looking more like a therapeutic than an actual vaccine because it's not stopping the disease. People who've got the vaccine are still getting infected. What is going on?
Well, it's true. And people that have been vaccinated are getting infected, but they're having milder cases. And so, and by the way, they can actually transmit it when they're having a mild breakthrough case. And so that is true. On the other hand, these vaccines are remarkably effective. And if you say, look, here's the way I look at it. It's not that the vaccines are less effective than they need to be. It's that we haven't gotten enough people vaccinated. That's the problem that we're having. It's not the vaccine's effectiveness. It's the effectiveness of our society to get people vaccinated.
Okay, so let me ask you about that, because again, we've got a big population that has had COVID. In Arizona, what would you suspect that number is out of 7.5 million people? How many people have been infected in Arizona? And then they say, I don't need the shot. I'm good. I've had it.
Well, it could be as many as 2 million people. I mean, we don't have that many diagnosed cases, confirmed, but a lot of people, especially summer of 2020, there was no testing at all, remember? And if you did get tested, the turnaround time was 2.5, 3 weeks. There's probably a couple million. To your question about, how protected are they? They do have T cells. They do have the B cells that create the antibodies. That give some level of protection. There's a huge clinical benefit to getting at least one vaccine dose after you've been infected. And that provides you a lot more protection. But if you have a previous infection, you do have antibodies and you do have T cells.
And the Israel study, large Israeli study said natural immunity provided 13 times more protection against Delta than the Pfizer vaccine.
Yeah, I haven't seen that study, but I'm not surprised. And here's the thing: is the vaccines are very targeted and specific to the spike protein on the virus, and so you're building a lot of antibodies to that spike protein. But a natural infection is building antibodies to the neocapsid, the rest of those antigens on the surface, and so it is more robust in terms of the variety of antibodies that your body's able to make.
All right, should we prevent people from holding down a job if they won't get the shot?
Well, to me, it depends on the industry and the job that you're in. If you're working in assisted living or skilled nursing, if you're working in the healthcare sector where you're providing the kind of care to vulnerable people, I think that we should have mandates for that, definitely.
Okay.
As you move into other sectors, it's a little bit different.
Will Humble, again, great. I think I owe you lunch again, my friend.
Okay, thanks.
Will Humble, just great information. The Executive Director of Arizona Public Health Association. Thank you, Will. When we come back
Thanks,
on
John.
Newsmaker Saturday, the son of the former president, Ronald Reagan, Michael Reagan, will join us to talk about where we are in this country. What would his father think about what's going on in this nation right now that's so deeply divided? We're back in a moment with the former president's son, Michael Reagan. Back on Newsmaker Saturday, Ronald Reagan is consistently ranked as one of the most consequential presidents in history. The fall of communism, the end of the Cold War, an unprecedented boom in the nation's economy, and strengthening the nation's defense. His son, Michael Reagan, keeps Ronald Reagan's legacy alive through the Reagan Foundation. He's a best-selling author and syndicated columnist. Michael Reagan joins us now on Newsmaker Saturday. Great to see you.
Hey, thanks for having me on.
You've got deep roots in Arizona. I did not realize all that. You were a star athlete at Judson.
Yep.
And recruited by Frank Kush.
That was Frank Kush's Ronald Reagan story till the day he died. Frank and I knew each other for years.
Tell me, you were a quarterback in high school, and Kush recruited you and offered you a scholarship through your dad, and your dad said what?
My dad said, give that scholarship to some young man who truly needs it, I can afford to pay for my son's college education.
Unbelievable.
Yeah,
Unbelievable.
you almost didn't have a president.
Wow. Yeah, right. You were going to take him out. So you ended up playing where? Did you end up playing college ball?
I didn't play. I actually ended up going to Arizona State for a while, and I dropped out of Arizona State. Actually, the person who recruited me for Arizona State went to Oregon. I was always sorry when my dad turned down Frank Kush. He didn't have me come to Oregon. But you know something? High school football player of the year, 1963, named in Scottsdale. That's good enough. It was great.
Yeah. Well, your dad, just a fascinating guy. Michael, the country is so divided right now.
Mm-hmm.
I don't think, I'm not sure. I mean, you'd have to, maybe, I hate to even bring it up, go back to the Civil War, to where the country was this divided. What would your father think about where we are right now?
You don't have to really ask what he would think. All you have to do is Google what's written over his gravesite at the Reagan Library in Simi Valley. I was just there the other day with 130 high school students that Young America's Foundation brought there from all over the country. I spoke to them the night before at the Ranch Center in Santa Barbara. And what I told them is very simple. We don't love ourselves anymore. America forgot how to love itself. And we need to learn how to love ourselves. You know, my father at his gravesite, engraved over his gravesite, talks about the goodness of man. In every man, there is good. And what he asks us to do is find it. And we haven't been looking for the good anymore. We need to look for the good, and we need to learn how to love ourselves and love this great, great country of ours that's done so much for so many people.
Michael, there have been a lot of comparisons made to your father with Donald Trump. And I'm not talking about the person, I'm talking about policy. If you start going down the policies of America First, strong defense, secure the border, although that was a problem with the amnesty bill in '86, but that's kind of where the comparisons begin and end, right? Because your father was a very happy warrior. Donald Trump, a lot more bellicose and a street fighter from New York. It's a different approach, isn't it?
Oh, it's absolutely a different approach. And I think Donald Trump had been reelected today as president of the United States had he paid more attention to what is written over my father's gravesite and paid attention to that than sometimes not paying attention at all and being that bellicose New Yorker, if you will, which I think ultimately cost him the election.
You do. You think that it became a situation where Americans could not tolerate the tenor of it anymore?
I think that's exactly what it was. It brought out the other side in great numbers, and it kept some of those at home. Remember, in Pennsylvania, we'd have two senators from Pennsylvania had not Donald Trump talked about being cheated and squelching the vote in Pennsylvania that helped elect Democrats to the Senate instead of the two Republicans. So you got to really watch what you say. And my father really understood this. And maybe that's because he grew up as an actor and what have you. But again, he was able to get along with the Tip O'Neills of the world. Republicans get elected when they reach out to independents and conservative and moderate Democrats. The Republican Party cannot elect anybody because they don't have the numbers to elect that big of a group. And my father really understood that. You can't kick people out of the party because they disagree with you on this issue or that issue. You need to find a way to bring them in and find the areas of agreement. And that's really what he talks about in that engraved statement over his gravesite in Simi Valley, the Ronald Reagan Museum.
Yeah, there's a quote, and I'm going to butcher it, but I think your father said, I'll take 70% of what I'm going for than to carry my flag over the hill and go off the cliff. Am I close?
Well, absolutely right. Absolutely correct.
Okay.
He understood. Politics is like a football game. You don't have to throw Hail Mary passes all the time. 10 yards at a time works, and you ultimately get to the other end zone. And he got there. But he was able to put together a great coalition during the 80s. Margaret Thatcher, Václav Havel, elect Valenza, Pope John Paul II. Just go through the list. And Mikhail Gorbachev, and he never took credit himself. You'll never see the word I in any of his speeches. He always gave credit He never took credit.
Wasn't that on the presidential desk? It doesn't matter, something about it doesn't matter who gets the credit, that kind of thing.
Just get the job done.
Get the job done.
That's what it's all about.
Let me ask you, we showed some video of January 6th, and you were pretty strong in some of your opinion pieces you did during that. You are a national columnist. I just want your take on January 6th and now reflecting on it a year later. Do you sense that there was a core of really, really violent people in that crowd, and then there were a lot of other people just kind of wandering in who may have not been a threat to the nation but did a stupid thing?
Oh, I think you nailed it. I do believe had that violent group gotten to the vice president of the United States, they would have killed him. I actually believe that.
You do believe that?
I do believe that. Thank God he had Secret Service, like I had Secret Service during the 80s. When my life was threatened by Muammar Gaddafi, they got very close to me. So, yeah, I get it. I understand it. And there are violent people in there. Now, whether they were supporters of the conservative movement or not, the violent people who got in there did damage. And I feel that Vice President of the United States' life was in danger for being there. And thank God the Secret Service is there to get him out of the way.
Your father's policies brought the fall of communism in, there were still, of course, pockets of it in Cuba and other places, but largely resulted in the fall of communism, the fall of the Berlin Wall, and ultimately the fall of Russia. How would he feel about where America is right now and this kind of drift toward a European socialism, for lack of a better word? I may be, not characterizing it exactly right, but you understand what I'm talking about. Bigger government.
He talked about that all of his life. He talked about that when he was in Hollywood and when he ran for governor and when he ran for president of the United States, that drift towards socialism. My dad was a Boy Scout. My sister Maureen and I used to sit there and kind of chuckle when Dad was running for president of the United States, that it wasn't really the presidency he was after. He was after his Eagle badge. That's what we felt about my father. He was the ultimate American and really, truly worried about a drift going to the left, to socialism, because he saw it. He was in the Second World War. Remember, he was the first president to speak at Normandy on D-Day. Right. So he saw it. It was an amazing speech. What happened today is we don't teach it. We really don't teach it. We walked away. I played golf with a young man the day before I left for France a few years ago to raise the American flag at Normandy, and this 28-year-old young man didn't know why there was an American cemetery at Normandy. Had no idea. No concept. My goodness. I've been there twice. It's incredibly stirring to go to Normandy. I've got to ask you about your father's 10-year battle with Alzheimer's. When did you think something was amiss? When did you first think, and I think you take it back pretty early in his presidency, that you thought something was up? Oh, not my dad. That's Ron. Ron saw something nobody else saw, but it was after the presidency. He was riding a horse in Mexico and fell off a horse and came down from many, many feet in the air and hit his head. That's what the doctors felt brought it on, if you will. But I saw it early 1990s. Okay, early 90s. So after his presidency. It was after his presidency. He was giving a speech. He was introducing Margaret Thatcher, and he introduced her twice. And we all knew, we got to do something. And Dad wrote that letter that really woke up America to the problems of Alzheimer's. Yeah, my sister Patty just came out with a book. Millions suffer, and I know your family has suffered. Michael Reagan, thank you so much for spending a little time with us on Newsmaker Saturday. Keep up the good work with the foundation, and thank you for your time. Thank you. Good to see you. Michael Reagan. Good to see you. As we go to break, let's take a look at the website. People talk about how do we see a prior show. This is a place. fox10phoenix.com/newsmaker. Back in a minute. Thanks to Will Humble. Thanks to Michael Reagan, son of the former President Ronald Reagan. And thanks to you for watching Newsmaker Saturday. And again, the website, if you want to get past programs or try to forward this program onto somebody, this is the best place to do it. fox10phoenix.com/newsmaker. That's it for tonight. We will see you next week on Newsmaker Saturday.